Good day. This is Dr. Neil Floch, and I'm here with Dr. Rubino. And today, an amazing article has come out in the literature in Lancet Journal. And this article compares surgery to the medical and behavioral treatment of diabetes. It is a 10-year study, a 10-year randomized controlled trial performed by the first author, Dr. Mingrone and Dr. Rubino. I have Dr. Rubino with me here today to discuss the study. Dr. Rubino, it is an amazing honor to have you. He is a professor at King's College, is that correct, in London? And I have several questions for you. This is just an amazing finding that we're all so excited about. How does your study differ from other studies that have been performed comparing surgery to medical treatment for diabetes?
First of all, thank you, Neil, for the opportunity to discuss our findings. So this is a randomized clinical trial that compared metabolic surgery and standard of care medical therapy and lifestyle interventions for diabetes. There are several other randomized trials that have done a similar investigation, looking perhaps at different operations. They're the one we have tested. But the most important aspect of this is that this is the longest follow-up in a randomized trial to date, and therefore we have the ability to look at the long-term effects of surgery, its safety long-term, but also its efficacy long-term as compared to the best possible medical therapy, the use of the most modern medications. So I think the findings of the studies are quite important because they tell us exactly what happens to diabetes in the long term.
Now, when you say the longest study, the longest before that was 5 years, and your study is 10 years, is that correct?
That's correct. We have at least 2 randomized trials that have reported data at 5 years before this. One was our own study published in the Lancet in 2015, and one was the Stampede trial from the group of Philip Schauer at the Cleveland Clinic, and the study has already reported about the 5 years follow-up. It's a slightly different study. It's probably a little bit, it's actually bigger in terms of size, and also tested gastric bypass and sleeve gastrectomy as a surgery. We tested a gastric bypass and also a different operation called Bileo-pancreatic diversion. But both studies were randomized and aiming at the same primary endpoint, that is control of diabetes and by measure of remission of disease. Our study, however, is the first to report 10 years follow-up.
So Dr. Rubino, when you say, a lot in the public, people are talking about whether information is significant or not, and they talk about misinformation. Now, the best kind of study that we have is a randomized control trial. And in your trial, didn't you compare one group that had medication, right? 20 patients? 20
Yeah.
Patients who had both other surgeries, correct?
So there were 20 patients who had medications, 20 patients who had gastric bypass, and 20 patients who had bileo-pancreatic diversion. They were randomized 1 to 1 to 1 to those 3 different types of interventions. Now, the important thing is that in the medical arm, which is very important for a long-term study, the clinicians were able to improve and change the medical therapies, the type of drugs utilized for diabetes, in order to reflect the latest guidance for diabetes care. And so also take the opportunity to use modern medications. So we use the most current therapeutic algorithms for medical therapies, not just the medications that we used 10 years ago. So this is the best that medical therapy can do. And we compared the results of that medical therapy to 2 types of operations.
Great. And what was the most significant finding of this study?
Well, it depends which perspective you use. I think there's more than one significant finding. For one, I think the study was looking at the long-term durability of the primary endpoint of the study, which was diabetes remission. And I think the important finding of the study is that at least more than 1/3 of patients who had surgery overall had a remission, not only at 10 years, but had been in remission for the entirety of the 10-year study duration. This is a remarkable finding, especially if you consider that the patients we recruited in the study are a bit different than the patients you find in traditional bariatric surgery, where many patients have early or recent onset diabetes and relatively mild. Here, by design, the study only looked at patients who had at least 5 years of diabetes history, and they had to be unable to achieve adequate glycemic control on best medical practices at the time. And they were put under an intensification of their medical treatment as they entered the study. So we're talking about a severe form of diabetes to begin with. Therefore, having some of these patients, actually a substantial number, maintaining non-diabetic status, diabetes-free status for over 10 years, in my opinion, is a remarkable finding. And I think we can say with confidence and meets the American Diabetes Association criteria for the definition of cure diabetes.
So let me get this straight. So you have taken the sickest diabetic patients, half of them on insulin, correct? And
Correct.
Studied them and followed them for 10 years. A third of them get gastric bypass, a third of them have the duodenal switch, and a third are treated with medication. And 37.5% of those who were treated with surgery were off all medication. We're not talking about on some medication. And you feel what? Do you feel that this is a cure for diabetes?
Well, I've been quite among colleagues have been notoriously reluctant to use the word cure for diabetes. And the reason is because we don't know the biology, the biological cause of disease. And so in a way, you can't claim a biological cure until you know what is causing the disease. But from a clinical standpoint, I would argue that if somebody is able to remain diabetes-free for 10 years, having no symptoms or sign or laboratory marker of diabetes for 10 consecutive years, I think we should be authorized to consider this as at least as a 10-year cure, as we've done in the past with cancer, where you might not know exactly if there's biologically any residual disease, but certainly if there is a disease, is a mechanism that is not capable of causing any more clinically evidence of disease. I think this is the closest that comes, and I think to a clinical cure of diabetes. And I think today I'm more confident to use that word than I was just a few years ago.
I think we're all a little careful to say cure, but I think if there is a cure, I think your study shows it. And I think it is going to be of much discussion in the future days as to the results of this study. And I want to thank you very much for the opportunity to speak to you today. I think it's a remarkable study, and it does show that surgery can really take care of diabetes, whatever terminology you want to use. If I had diabetes and it's gone for 10 years, wow, that would be remarkable. And I thank you so much.
If I can just add a last little thing, you asked what is the most remarkable finding. Obviously, to me, from a scientific point of view, the ability to potentially cure diabetes is the most remarkable thing. But don't forget that the study does show that if you take patients with severe diabetes, you give them medications or you give surgery, the patients who had surgery had much better control of diabetes overall, regardless of remission. They were doing better. They had better quality of life. They had less complications from diabetes. So there is no question at the moment with this study that surgery is much more powerful. Maybe it's not for everybody, but it's certainly something in 2021 cannot be ignored by anybody who takes care of patients with diabetes.
So certainly it shouldn't be ignored. And this is a remarkable treatment, whatever you want to call it. It really is the way to go if you have diabetes and obesity. And I think that your work is incredible and the world will be changed for it. So I thank you very much.
Thank you, Neil.
Have a great day.